It's a good day here on Welcome to Our Community as I get a chance to introduce Dr. Maulik Patel, who is a geriatrician. So we know that you deal with many of the problems of when we become older. Explain more of what you do.
You know, as we're living longer, as we're aging, our body is changing, and the way our body can process medications changes. Is one of the biggest things that we address. But along with that, as we age, we accumulate more medical illnesses, and those medical illnesses interplay on one another. The medications we take interplay on one another. And as we change physiologically, we have to start to pay attention to how it's affecting us and really change our strategy of how we approach our health. And so, you know, for me personally, I like to make sure that patients are becoming more aware and better managers of their own health, and then making decisions that actually benefit them rather than doing something because they've been doing it for 20 years and staying on a medicine which could potentially be harmful.
That's right. Well, one thing that I think might be an issue is that as we all get older, I think it's hard for us to accept that we're not only older, but our bodies are changing, and even simple things may be a little bit more difficult.
Yeah, and so, you know, many times we notice that initially with things like joint pain, with things like lapses in memory occasionally, and that can be due to stress. People always worry about dementia, and I see patients that are worried about dementia, but usually when a patient comes in and tells me they're worried about their memory, it's probably not dementia. But we worry about these things changing, and as we get older, a lot more surgeries may be a part of how we're aging. And so those have an impact on our brain health, our kidney health, our heart health. And so kind of putting it all together, we start to notice that we're not as quick about things. Maybe things get to us a little quicker. We don't have the endurance like we had. And knowing what's physiologically normal and knowing what's physiologically abnormal, things that need to be investigated or evaluated is important part of our health.
Well, as you mentioned, the name dementia, we hear that so often, which affects the memory, but there are different degrees of it.
Yeah, and so, you know, generally when people hear dementia, they, you know, my patients will tell me about old-timers, and Alzheimer's is the term, but the dementia term is an umbrella term. And really what it means is our memory is so severely impaired that we cannot function as an individual, and that's paying bills, that's taking care of our house, that's remembering to take medications or go to our appointments. You know, it's the memory impairment plus some functional impairment. That's dementia. And dementia comes in a lot of flavors. The most notable one is Alzheimer's disease. Alzheimer's disease can lead to Alzheimer's dementia, and that's one type of dementia, but there's, you know, dementia with Lewy bodies. There's dementia that develops due to Parkinson's disease. Ultimately, treatment with medications for Parkinson's disease leads to a depletion of the neurotransmitter acetylcholine, which is essentially causing the dementia at the sort of the late stage of Parkinson's disease. We know from famous celebrity individuals about frontotemporal dementia as well, that some have had. And so dementia comes in a lot of forms, a lot of varieties, and it's important when we're thinking it may be a cause to know what is the cause or what is that etiology behind it, because treatment options are different, treatment strategies are different, and treating all dementias one way can lead to harm as well from the medications, even though it seems like it's just a pill that I'm taking.
I think as we get older, there's subtle changes in our memory, so I'm not as sharp as I was when I was 20 years old, but when should we really be concerned to mention it to our doctors? I know I pretty much overshare with my doctors, but a lot of people don't do that.
Yeah, and so I would generally say that and it's easy to, you know, make it as simple as two types of patients, but I would say that there's patients that underplay every symptom, and then there's patients that overplay every symptom. But I would say if you are concerned, definitely bring it up. Most of the time, if it is true dementia, it's going to be someone else that's noticing your symptoms. It's going to be a coworker. It's going to be a spouse, a partner, son, daughter. Someone in the family is going to say, we just talked about that. Right. You're not remembering this. And so that, I think, is more crucial. Usually when patients come in and talk about their symptoms, a lot of times it's due to stress. Many times when I see patients, and first step really is to figure out, is there any metabolic reasons as to why they may be having these memory lapses? And if it truly is what sounds like dementia or could be cognitive impairment, basically from what the family is saying, then there are tests that we do in person with the patient in the room, in the clinic. And then there are secondary tests that we can do that include imaging of the brain if necessary, based on how much, what their symptoms are. And even getting referrals from specialists. We may involve specialists based on some of the symptoms that they may be having.